Longer treatment duration is commonly assumed to reduce risk through averaging. Repeated successful courses are taken as evidence that further exposure is safe, but each exposure event is independent. Past tolerability does not reset the risk of the next course. The clinical history of successful treatment does not protect against future adverse events. Each course is a new trial with its own failure probability. Cumulative drug dose, cumulative radiation exposure, and repeated surgical procedures each add independent failure probability. Risk does not average out with repeated courses, it compounds. The relevant quantity is not whether any single course was tolerated, it is whether the patient survives the full sequence of exposures without an adverse outcome terminating the trajectory. The probability of surviving all treatment courses decreases monotonically with the number of courses. Even if each course carries a small adverse event probability, that probability accumulates. Course independence does not imply safety. It ensures that adverse events across courses are uncorrelated, not that they cannot compound into eventual harm. If any positive probability of adverse outcome exists per course, then as the number of courses grows without bound, the probability of experiencing at least one adverse event approaches certainty. This is not a clinical tendency. It is a convergence result. The question is not whether an adverse event will occur. The question is when. Population average response may improve with repeated treatment cycles, but the individual patient's cumulative toxicity risk rises with each course. Trial data reports ensemble averages, outcomes averaged across all enrolled patients. The individual patient is a single trajectory through time. Averages describe populations. Survival is a property of a single patient's path. Lifetime risk increases with repeated exposure. The concept of a safe annual dose addresses single-period exposure. It does not address the structural accumulation across many periods. Repeated safe annual doses are not guaranteed to constitute a safe lifetime exposure. Cumulative exposure logic requires tracking the trajectory over time, not just the risk of any single course in isolation.